talking about the hypoglossal nerve, which is responsible for protrusion of the tongue. So the hypoglossal nerve is a motor nerve that controls all the muscles in the tongue except the palatal-glossus, which is controlled by the vagus nerve. And the tongue muscles consist of intrinsic muscles, and those control the shape of the tongue, and extrinsic muscles, which protrude, retract, and elevate the tongue. And they also move the tongue side to side. And healthy function of the hypoglossal nerve is critical for eating and speaking. So the hypoglossal nuclei are found in the medulla, and hypoglossal nerve fibers leave the hypoglossal nuclei on each side of the brainstem and descend to travel to the same side of the tongue to stimulate the muscles of the tongue from below. And so if the hypoglossal nerve is damaged, this could lead to tongue weakness, impaired tongue dexterity, and may also lead to small muscle twitches or vacillations in the tongue, as well as atrophy of the tongue, especially at the tip or the borders of the organ. If the hypoglossal nerve is only damaged on one side, then the atrophy will typically be seen on the tongue muscles on that same side. And if someone is asked to protrude the tongue, it's oftentimes going to deviate towards that side of the damaged nerve. And with damage of only one hypoglossal nerve, most patients are able to compensate for the deficiency of the tongue muscles on one side, but unfortunately, if both nerves are damaged, the client may not be able to protrude their tongue at all, and may also experience difficulty when swallowing and speaking.